Okay, good evening. Welcome to another in our series of Synoptic Economics webinars. What we do every week is we take a key topic that we think has lots of synoptic connections between micro and macroeconomics as part of your A-level course, from the personal to the business perspective to national and international economics. We try and take something that is topical, hopefully interesting, and the idea is to get you to see the bigger picture in economics, see how different aspects of your course fit together, link together, because the synoptic element is an absolutely key part of assessment at A level. So the more of these you do, the better we get at it. Well, tonight we're going to take a look at the economics of an aging population. So this webinar looks at synoptic issues surrounding aging economies and tries to focus on questions such as how will aging affect productivity, innovation, competitiveness of countries, growth, economic growth, and also, crucially, the future of the welfare state. We know that the share of old people is set to rise dramatically in the next few decades, and not just in the UK. It's already happened, for example, in countries such as Japan and Germany, and China too is aging quite rapidly, leading some economists to ask, will China grow old before she grows rich? So what will be the impact of having an older population? How will dependency rates change? What reform of health and social care might be needed? Or will, in fact, before that happens, will attitudes change towards the whole concept of ageing and retirement? Well, we're going to look at some of these issues. Before we do that, let's look at some of the data on the changing population structure in the UK and also in other countries. So, declining fertility, fall in fertility, and increasing longevity have created what is often termed an ageing population. At present, there are about 12.4 million people of pensionable age in the UK, but by 2041, that figure is forecast, is projected to increase by nearly 4 million to 16.3 million. By 2041, over one-fifth, nearly a quarter in fact, of the population will be of pensionable age, and about one person in age will be older than 75 years. England, for example, just England, will see a projected 50% rise in those people aged 65 and above, and a 100% increase, a doubling, in those aged 85 or higher between now and 2030. Now, this is a huge increase in the number of older people. It's going to have a profound impact on a whole series of economic issues, including things like public services and the NHS, for example. One of the key questions, of course, is who will eventually bear the burden of ageing? Will the state continue to provide and fund the full range of social services for the old? Or are we contemplating the end of inheritance, perhaps as the burden of paying for care in later life passes directly to families? In other words, you and I. So here's a chart showing the age structure of the UK population in terms of splitting the population into 5-year segments. The baby boomers, born in the late 50s and early 60s, are now moving into retirement. I'm in my mid-50s, for example. I was born in 1963. And generally speaking, overall people are living longer. Look at the figures for 2046 compared to 2016. Now, higher life expectancy, I think, should be celebrated, but undoubtedly Britain faces those big challenges. How do we respond to an ageing population? Have a look, for example, on the chart at the number of people forecast to be aged over 90 by 2046. The average life expectancy of a girl born in 2015 is 94 years and 91 for a boy. This chart shows median ages by selected countries. The UK's median age is now above 40. China is catching up quite rapidly. Brazil and India obviously have much younger median ages. The lowest, I think, in the world is Niger, with a median age of just 15. But notice that Japan and Germany are significantly above in terms of these figures. These countries are undoubtedly aging to a much greater extent. And this is what's happened to the median age in the UK. So, median, of course, is the midpoint in the distribution, and you can see it's increased from 34 in 1974, and it's gone up to just touching 40 in 2014. Of course, that figure will continue to rise. One of the key measures of demography, one of the things that you'll be talking about if you get a question on the aging population, is the dependency ratio. Now, the age dependency ratio, there are various measures of this, but the key one is it's the number of children aged 0 to 15, people not in work, the number of people who are in retirement. So those two groups added together, divided by the number of working age people, for example, currently 16 to 64. So that may change as the state retirement age moves up. So that dependency ratio, as we'll see in a minute, has been going up quite rapidly. There's also another slightly different measure, the real dependency ratio, which is the ratio of economically active people who could actually be quite old if they've stayed on in the labour market, divided by the number of economically inactive population. Just in terms of the age dependency ratio, it's predicted that each person of the new full state pension age in 2035 in the UK will be supported by 2.87 people of working age. So under 3 people of working age, compared to 3.22 people in 2015. And here we see what is happening to the old age dependency ratio. That's just older dependents compared to the working age population. Quite a significant change happening in recent times. Here's another chart. Again, all these charts are showing pretty much the same thing, aren't they? That this is the population aged under 16 and 65 and over. And you can see that the projection is that in a few years' time, the number of people aged over 65 will overtake the number of people aged under 16. Another aspect of our aging population. And a crucial point, I think, is that life expectancy has gone up. That's for the UK as a whole. So there's been an increase in the average life expectancy. But actually, what we want to do sometimes is dig beneath the data. And we find that if you look at life expectancy according to where people live in the UK, according to the areas, the localities with the best or the worst economic and social deprivation figures, we find that there's a significant decrease in life expectancy between those areas. So parts of the country, life expectancy is stuck in the low 70s in the most deprived areas, whereas in the UK, in the best areas, it's the mid 80s. And notice crucially this maroon figure, healthy life expectancy. In the most deprived parts of the UK, high unemployment, economic inactivity, oftentimes chronic health and social problems, healthy life expectancy is just over 50 compared to 70 years, 20 years more in the least deprived areas. So whenever you get a national figure for life expectancy, remember to disaggregate, dig beneath the data a little bit. Oftentimes you find something more interesting. We mentioned Japan a few seconds ago. Japan is probably the best example of a country that is aging rapidly, as you can see, and also shrinking in terms of demography. Population is aging, and in fact the total population is likely to decline going forward. Major issue for that country. And aging is not just a kind of Western, North American sort of advanced economy perspective. This chart shows the estimated population for people aged 50 and above in millions, and as a percentage of the total population for 2025 in a whole series of sort of emerging Far East Asian countries. Thailand, for example, by 2025, nearly 40% of the population will be aged over 50. In China, 40%. Compare that, of course, with India, where just over 1/5 of workers will be over 50. So there are many synoptic issues that we might want to think about. Whenever you get a question on the aging population, if the examiners want to test you on it, they will probably focus on the connections between demography and micro and macroeconomics. So, for example, how we fund social care. We'll come back to that in a second. How we fund basic healthcare services for the elderly. To what extent does aging impact on productivity growth? What about the demand for healthcare services, acute services, for example? What about the burden to the state in terms of providing basic healthcare as opposed to social care? Aging population, of course, is also going to affect people's spending patterns. It's going to affect people's decisions about when to retire, how to fund their retirement, indeed whether to retire. And it's going to have an effect on the debate, I think, on migration, particularly as countries whose populations are shrinking look to supplement their population with younger, skilled workers. This chart is quite interesting. Why aging matters in one picture. Consider in particular what happens to healthcare and social care spending per capita, per person, across the life cycle, especially when people move beyond the retirement age. So look at spending per capita on health and social care once one gets into the mid-60s, into the 70s, etc. The figure obviously rises sharply, but equally the tax revenue per capita from these people falls away, and hence older people in that sense are quite a significant net burden on the state. The social care, the welfare issue, I think is absolutely crucial to this debate. About just over half of total welfare spending currently gets paid to pensioners, not just in terms of the state pension, but also in terms of some other handouts as well. The state pension is the biggest element of it. We know that the prevalence of chronic health conditions, including some disabilities, for example, increases with age. And according to an estimate made about 5 or 6 years ago, these chronic health problems account for over 2/3 of total health and social care spending in the UK. The average cost of providing hospital community health services for a person who's aged 85 or more is nearly 3 times greater than for a person who's 10 years or so younger. Now, clearly a rise in the elderly population, particularly if it's not matched by health improvements, is going to place huge pressure on public finances. I think a couple of years ago, councils in England spent about £17 billion on social care for adults, and £7 billion of that went on people aged over 65. This chart shows the estimated prevalence of dementia across OECD countries for 2017 and the forecast through to 2037. You can see that the percentage of people with dementia per thousand of the population is forecast to rise in virtually every country, and sometimes quite significantly. What we can see from this chart is that aging increases the risk of a certain type of a costly illness, for example, dementia. But I think a key evaluation point is that aging does not automatically mean worse, higher health and healthcare spending. The crucial point is the extent to which we see healthy aging. How much, and that's going to really determine how much aging increases health spending. State spending on total long-term care, that's health and social care, does vary quite widely across the OECD countries. So typically, if you look on the left-hand side here, Scandinavian countries and the Netherlands, they allocate a much higher percentage of their annual GDP to public long-term care spending. Whereas if you go across to the right-hand side, the United States, for example, that percentage is less than half of the UK and only a third of the OECD average. So one of the big issues is going to be to what extent will the ageing population affect the demands, the pressures, the financial issues facing the National Health Service. Just want to pause for a second and say that the healthcare spending in the UK is not just purely driven by demography. Lots of other factors, including, for example, new technologies and treatments as new drugs become available. And even relatively cheap treatments can be expensive in the sense if you're going to treat a cheap new drug, which then becomes widely available, the total spend on those drugs can be run into hundreds of millions of pounds. As incomes go up, people typically want to spend more on healthcare, so there's a positive income elasticity of demand. We know that there's a correlation between income inequality and healthcare spending. The diseases of relative poverty, including malnutrition, including poor housing, including chronic stress conditions, mental health issues, are linked to economic and social inequality. Productivity in healthcare services is quite important. Healthcare is relatively labour intensive. If you think of a typical hospital ward, for example, and that makes it harder to generate year-on-year productivity improvements. But wages, of course, paid to the employees have to keep up with the rest of the economy as best they can. So there's quite a strong wage cost pressure in the health service. And the balance of power in the market between the purchasers of drugs, the NHS, and the oligopoly suppliers, the big pharmaceutical companies, that also has an effect on the total bill for example, prescription drugs. Just a thought about mental health. The King's Fund, one of the best sources of information on this, they think that mental health costs, including dementia, will rise nearly 50% from 27 to 2026. Here's a chart showing the growth in real health spending per capita relative to the growth in real GDP. You can see here there's a relatively strong positive income elasticity of demand for healthcare generally. What will happen to the state pension age? So we've talked about the demands for healthcare going up. There is also pressure, I guess, on the state pension age, the age at which people, in theory, can retire and take the state pension. The core principle behind the state pension in the UK is that people should expect to spend, on average, up to about a third of their adult life, beginning from, let's say, 20, in receipt of a state pension. So a third of their adult life in receipt of a state pension. This third of life principle, by the way, is known as the longevity link. Now, clearly people are living longer. So, therefore, the state pension age needs to edge higher. But only to so very slowly. Now, it's going to go up by another year to 67, sometime between 26 and 28. It will go up again between 2037 and 2039, up to 68. Once we get to 2040 beyond, who knows, we may be getting close to a 70-year-old state pension age. Or will the state pension age have disappeared by the time young people watching this broadcast have reached that age? The state pension currently is £155 per week if you're on the current system. The government's brought in a triple lock designed to kind of maintain real living standards for pensioners. So the state pension each year rises by either CPI inflation or average earnings growth or 2.5%, whichever is the higher, the so-called triple lock, which actually builds quite a bit of expense into the system. Nearly 13 million people get the state pension. On average, they get about £7 a year, and that's about £3,300 per household if you think about who pays the tax. So it's not a huge pension, but of course it's a very, very significant fiscal commitment the government's got. Another issue to do with the ageing population is whether the demography is going to cause productivity to slow down. Is an ageing workforce less productive? Is it true that older workers are typically less dynamic than younger people in the labour market? Or are we at risk of assuming too easily that older workers, perhaps with higher incomes, perhaps they have a different attitude to life, might be less efficient? What is the value of accumulated experience, for example, in the labour force? Who knows? It could be the case that if there's a shortage of workers, in part from ageing population, as well as a fall in migration post-Brexit, that could actually cause companies to invest in new capital, which will increase the capital stock and perhaps provide a stimulus to productivity. A World Economic Forum article last year argued that skills and abilities of older workers are not so much declining as shifting. And a smart employer, smart business, best knows how to take advantage of the changing strengths of an ageing workforce. And I think critically, a lot of economics now is about not just physical effort, but about knowledge, about know-how, about blueprints, about the ability to work in teams and collaborate. So knowledge and know-how matters. Things like fluid intelligence, your capacity to learn abstract concepts and reasoning. Well, they may diminish with age, fair enough, but the knowledge acquired, experience that you have can often compensate significantly for that sort of less quick acceptance of fluid intelligence. And there are lots of examples of employers. B&Q is a good example, I think, who recognise the benefits of older workers. They're reliable, they've got skills, they've got experience, particularly if they have a lot of experience of a particular firm or industry. So what I'm suggesting here, and here's a nice study from a study of German car makers, that businesses who adapt their production lines, who respond to the challenges of an ageing population, can often find that the workers they employ, even if they're older, are just as productive, and indeed they may well be even better than the younger workers they could employ. One of the big risks from an ageing population is increasing levels of long-term unemployment. This chart, I think, is revealing. It shows that opportunities to work at an older age vary considerably amongst OECD countries. 82% of older people in Iceland, for example, were employed in 2013. But if you look, only 48% in Slovenia. Most countries plan to increase the official age for receiving a pension, but often in many countries the rate of long-term unemployment amongst older workers is significantly above that of younger workers. As you can see, only the Czech Republic has a lower rate. Big issue is this question of, are people saving enough for retirement? I mean, the simple answer is that many people are not saving enough, and the government's got a job to do to improve pension schemes, which are for millions of people actually just inadequate. Okay, there's a strong default, for example, amongst younger people, not to think about pensions until it's often too late. The government's brought in auto-enrolment in occupational pensions, and that's worked to a degree, as we'll see in a few minutes. But many people actually don't have the money to be able to save. And it's true that if you're going to live longer, if you're going to live, let's say, 30 years after you retire, then you're going to need to have a significantly higher level of wealth to fund your retirement. What effect will the ageing population have on the housing market? Will it cause house prices to go up even further? A lot of older people now are more active, more independent for longer, well into their mid-80s, and therefore they continue to live in their homes, whereas in the past perhaps they might have sold their homes, increased the supply of homes they were able to buy, and put a bit of downward pressure on price. The crucial issue, I suppose, is the care system. What kind of care system will emerge? At the moment, the care home industry, one thinks about sort of retirement homes, etc., is not dissimilar to monopolistic competition. You have some national players, but often it's very, very localised, local care homes, each providing a kind of distinctive, differentiated service. That may well become more oligopolistic in the years to come as big companies invest heavily in care homes on a big scale. For the moment, it's quite imperfectly competitive. It's not overly monopolistic. The big change is likely to come when people shift towards informal caring. So millions of people in the next few decades will have to take some time off work, for example, or perhaps give up work, move from full-time to part-time to look after your nearest and dearest. Ask yourself a simple question: Will your children be willing and able to support you in your old age? And the answer is, in some cases, no. What tends to happen is that wealth, this is for the UK by the way, I think, wealth tends to peak close to retirement, as you can see here, both of you including take-out housing, and then it falls gradually. So people need to accumulate wealth, particularly in the 40s and 50s, and then gradually that wealth is dissipated. Older people tend to be net spenders and save a little less. A quick word about auto-enrolment. So this is the government's behavioural nudge to try and get more people to start saving in an employer-provided pension scheme. So they have brought in mandated choice, or auto-enrolment. And you can see that it's been quite effective. There's been a 22% increase in the number of people in large employers who have enrolled in a pension scheme. With medium employers, there's been an even bigger increase, 32% increase, 44 to 76 in people joining these occupational pension schemes. The problem, though, is that millions of workers have been excluded from this scheme simply because they're either too young, or they work part-time, or they're self-employed, or they're in a low-wage job, for example, in the gig economy, and they simply cannot afford to put aside money for a pension. Low interest rates are also a problem. The low returns on saving, for example, make it difficult to grow yourself a good pension. So some progress in terms of getting people enrolled in pensions, but some difficulties along the way. For businesses, again, from a microeconomic perspective, businesses have to respond to an aging population. Not only is the share of older people growing rapidly, but people also tend to work for longer. So businesses will have to offer their employees more flexibility about how long they work, for example. Equally, many older people exit the labour market because they can't work. They've got illness, they've got some disability, they've got some care commitments, or they've become unemployed, or whatever. So there's a whole variety of scenarios here. Crucially, I think what you're going to find is that as populations age, and perhaps, as in the case of Japan, as they shrink, there will be pressure for businesses to pay higher wages to hang on to their existing staff and to give them a better work-life balance, improve their conditions of work. We may also see an acceleration of the investment in labour-saving capital technologies such as robotics. Good businesses also will understand that the patterns of demand in markets will change. The grey pound, or in my case, the bald pound, is worth billions and billions of pounds and dollars already, and that can only get bigger. And so, crucially, businesses have to be ready to meet the changing spending patterns in the consumer markets. And we talked before about companies recognising that older workers have know-how, experience, good at working in teams, and that should influence who's employed. Maurice Chevalier famously said that old age isn't so bad when you consider the alternative. And from a business perspective, old age isn't so bad either, because it's going to increase demand for certain types of goods and services. Expect the demand for DIY and garden products to increase significantly. Expect the market demand for cruises and experience holidays and over 60s triathlons and long distance walking challenges. Lots of people, if their healthy life expectancy grows, they're looking to spend their money on those kind of things. There will also be a rise in demand for sheltered housing wardens, for example, housing which has a sort of maintenance payment aspect to it, where there's a kind of full-time care on offer. Increasingly, as you can see from the image here, older people might be taking nutritional products, not necessarily talking protein shakes, but if you go into any chemist these days, Boots, and for example, the whole aisle's full of stuff, and it's not just Synoptic for people to buy. Spending happens. The point I'm making is that spending habits tend to change with age, don't they? In fact, for many older people, shopping is more of a social experience, often very localised. Local coffee shop or the local corner store. They shop more frequently, for example, because it's part of what they want to do during the day. And really smart businesses, very smart businesses, will understand this and will plan accordingly. Finally, let's just think about some of the policy options ahead of the change in the ageing population. Effectively, the default retirement age has already ended, so people can basically essentially work as long as they want. The state retirement age is nudging up, 65, 66, 67, and it'll go higher. But the actual default retirement age, when the employer can insist on you leaving, has actually now disappeared. I think one of the big issues, certainly something that Japan has to face, if you've got an aging, shrinking population, if you want to keep your per capita incomes where they are, or even move them a little higher, you've got to raise the productivity of the workers who are left. So as the dependency ratio goes up, one of the strategies are policy reforms, supply side policies perhaps, apprenticeships, big investment in proper training to try and lift productivity. That's going to be a really key point. Now, the policy we've mentioned already, auto-enrollment in pensions, to try to get more people to start to build up their pension wealth and not necessarily just rely on the housing market as their main source of wealth going forward. Another policy, should there be a new tax on social care? Should the government bring in a sort of progressive, means-tested tax on, who knows, net household wealth, a proportion of which would go directly to targeting and spending on social care? Policies, we're going to need to increase the supply of housing. We need to change the pattern of housing and get to perhaps build more smaller homes, often with the sheltered aspect to them. The government clearly needs to think about how best to encourage governments, communities to invest in lifelong learning, particularly for the over 55s. And of course, migration policy will be a key thing to think about. So higher migration would improve the situation as immigrants are typically or more likely to be of working age, younger, adding to the working age population and therefore bringing down the dependency ratio. So all kinds of policies that the government could and perhaps should be introducing, anticipating what's going to happen rather than just reacting to it. I think generally speaking, this is my last slide here, I think the economics of an ageing population brings so much together. It's about behavioural economics, for example. How can we nudge people to make better choices when it comes to their pensions, towards their lifestyles? How can we nudge people to save long term for the future? Ageing population raises big questions about equity, about fairness across the generations. Who will pay for social care? Typically, a young family in their mid-30s has far less wealth now than a family of the same age 20 years ago, in part, of course, because of the financial crisis, but a lot of old people have hung on to houses and properties worth a lot of money. It's about not just equity, but about promoting healthy ageing. Life expectancy itself, I think, is less important than healthy life expectancy. It's about raising productivity to pay for older people. It's about tackling ageism, a form of discrimination in the labour market. And crucially, if your glass is half full, it's about seeing the opportunities that an ageing population will bring, not just the threats. What is clear is that the ageing population is a profound change, not just for the UK, for many high-income and emerging developing countries. It's a profound change, but it's also perhaps one of the biggest opportunities that we've had as a country, as a group of nations, for many a long year. And as I've said before, the best businesses, the best governments are fully aware of this and are already starting to plan in a contingent way for the future. Okay, folks, thank you so much for joining in this webinar on the economics of an ageing population. We've covered healthcare, social care, productivity, innovation, and much else besides. Check out lots of our other videos on the YouTube site. But for now, thank you very much indeed for coming on board, and chat to you soon. Cheers now.